What is up, world? John Shoot here with another PufCreativ podcast. Today, I have the pleasure of being with Katherine Golden and Eloise Theisen of Leaf411. Katherine and Eloise, how are you doing?
Great. Thank you for having us. I'm excited to be here.
Yeah, thanks, John, for having us.
My pleasure. My pleasure. I've had the pleasure of working with both of you pretty closely over the past couple months, working on the Opioid Awareness Guide. We'll circle back to that towards the end of the podcast. If one of you could give us a little overview of what Leaf411 is, that would be awesome place to start out for the podcast.
Sure. So what is Leaf411? Well, Leaf411 was first and foremost created to tackle healthcare inequality. That was the biggest concern I saw when I was a cannabis nurse in a private practice here in Colorado. I saw that only people who could afford the out-of-pocket expense of seeing a physician to even ask the questions if they needed to, how do they use cannabis? Do they need a card? Do they, is it something that they should even look at? Only the people that could afford that out-of-pocket expense for the medical card, for the doctor's appointment, then for the expense of medicine could get that guidance from us. But what about everybody else? So that's kind of where the idea popped in my head that, I needed it to be for everyone. I wanted it to be for everyone. I know this is going to roll into my personal experience, but that's where it started. Being the nurse in my family, my brother-in-law was suddenly diagnosed with stage 4 lung cancer and given 2 to 5 years to live. Never a smoker, kids in high school. My family was devastated. And me being the licensed medical professional in the family, we heard the word cannabis kind of thrown around, but really they didn't know anything about it. So I just went ahead and said, well, let me take on cannabis. It's here in Colorado. I voted against it for adult use. I was like, I believed everything, all the propaganda I believed. And then that's where
Wow.
Leaf started. Yeah, I know. I'm
Wow,
always
I didn't know
honest about
any of
that.
this.
I
Wow.
voted against it. I wasn't informed. And but that's where Leaf, going back to your question, how did Leaf come
Yeah.
about? That's where it came about because I could help my sister and my brother-in-law because I knew about cannabis. What about everybody else who don't have medical professionals in their life or who can't afford to even pay the $150 or $300 just to go to a clinician and say, can I use this? So that's where it started.
Interesting. And now, like, I know you promote yourselves as a nurse hotline, but I feel like you're so much more. You're a nonprofit. You're an educational hub for folks, and I'd say anyone can reach out to your hotline at any time and get any of their questions answered about cannabis.
Yes, yeah, anybody can call. We are national. We've actually, I like to say we're even global because we get chats on our homepage, and we have taken, chats from France, from Australia, from South America, from
Whoa.
South Africa. We get calls from Canada. So we're global now, but mostly in the United States. I think our last quarterly data analysis, we track, the zip codes of people that call. And we can show that we've received calls from, I think, about 46 out of 50 states now of people asking about cannabis. So it's very, that was the number one thing. That was the number one goal in mind. It needed to be easily accessible, so a phone line, and affordable, so free. So nonprofit was the way to go. And a hotline was the way. That was me wanting to really make it a hotline. I was told in the beginning by a lot of people that it was very antiquated, and I knew it. Oh, are we going back to the 800 days? And I'm like, yeah, because with a phone, anyone has a phone. When people were suggesting, oh, you should start off with apps and stuff, I'm like, well, you're leaving a lot of people who are non-digital natives out, who don't have access to smartphones. You're leaving a lot of the community out, and more so the underserved communities that really need some guidance and should have equal advantage to the same healthcare as everybody else does. So that's why a hotline was born.
Interesting. Yeah, I agree. And I feel like you can get lost, doing your own personal research in medical, advice in general, let alone cannabis, which still there's so much limitations behind what can actually be on the internet and like what's valid and like how much research has actually been done in certain areas. And as personally as a marketer and advertiser, I have so many different barriers and limitations to what we can actually market and educate people on in a certain way. So to me, it's very valuable to have a hotline and resource like you, who are medical professionals and can guide people in the right direction, especially in, you know, emergency situations you call them, or something that someone needs to know, right on the spot. So very helpful. And I guess I kind of just, we'll dive right into your story a little bit more. I know you touched on it. So that was kind of your inspiration for starting Leaf411. When did your nursing career start? And yeah, like where are you
Very
from
long time
exactly?
ago, John. 25 years ago, 26 years, I think this
Okay.
year. I've been a nurse for 25 and a half years, and in cannabis nursing for about 5. So it started, like I said, 2016, we voted adult use. I would still
Mhm.
believe the propaganda. I didn't, it never worked for me personally. So, there's your biases like, it didn't work for me. I saw friends who used it that just, didn't seem like they were using it for motivation or anything like that. So, so I was clouded by that, and until it took, and it's funny when you're in this industry, you talk to people and it's usually a personal story that leads them into this in some
Yep.
way. But that was my personal story. I would have never, I was retired as a nurse. I was like, I'm out, I'm just going to raise my daughter and all of that. And this really dragged me back in because I felt the need. I was angry actually when I found out that there was a lot of science. You hear that all the time. And still to this day, I can't even believe it. To this day, even in a work group here in Colorado, just last week, people were saying, there's no science. There's no science that CBD or THC has any medicinal benefits. I'm like, what are you saying? There's zero science. So that language is still being used today, which is crazy. So imagine me 5 years ago. Yeah, I was believing it and then when I saw going to what clinicians go to for their resources, you have Science Direct, you have PubMed, you have these wonderful resources, and then you're seeing they might not be the ideal that studies you want to go to, the double blind
Mhm.
placebo, but you still have in vivo and in vitro models. Those are animal and lab models. You still have something that's showing that there's promise, and that's what was exciting.
That's awesome. And has your journey always been in Colorado?
Well, no, I started off cannabis, yes, but I'm from California, so my whole nursing
Okay.
career was California. I've been in Colorado since 2005. Yeah, so the whole cannabis experience has been in Colorado.
Interesting. Yeah, no, it's funny, like two like states that are kind of known for cannabis in general though. So again, to your point, I always find it interesting everyone's story and how they got involved because everyone has a different one and it's kind of a beautiful thing. And speaking of stories, I know we haven't heard from you too much, Eloise. Wanted to just dive into a little bit, more of where you're from and how you got into nursing leading into the cannabis space and how we're here today.
Yeah, like Catherine, I've been in it for a couple decades now and started out in California. I've been in cannabis in particularly since 2012 or 13. It's hard to keep track of time these days, but mine
It
was a
is.
personal journey, with actually with opioids. I had been in a pretty severe car accident that left me disabled by the age of 35. So I started looking for other opportunities to treat my chronic pain because every time I went to the physician, it was take this pill, take this pill. And I actually ended up with called serotonin syndrome. So I ended up in the emergency room where, it can be a very serious condition. If not treated, you can end up in a coma, you can die. And that was a result of polypharmacy. And it was sort of at that point that I recognized that my journey of, using these medications to treat my pain wasn't, it was fascinating because as a healthcare professional, I believed in everything that I had recommended up until that point. And then the light bulb went off and I said, oh, this is why my patients say that their pain's not being well controlled, because it's not. This is why they're seeking other, more opioids or more medications, because they're really not getting the relief that they want. So having that firsthand experience was very eye-opening for me. And I came back to cannabis. I'd been a pretty heavy consumer in my teens and, you know, gave it up when I went into nursing school and came back to it and realized, you know, for me, it worked. And then I thought that was kind of it. You know, I'm like, it helped me on my journey. I went back to school. I became a nurse practitioner. But then I had oncology patients asking me about it every day, to the point where I recognized that there was really, you know, an opportunity here to educate them. You know, like what Katherine was talking about, the reason that Leaf411 was born was to help, you know, create opportunities for people to become educated, not just patients, but also, you know, healthcare practitioners. And, you know, we want to make sure that we're diversifying these options for people, that they have opportunities beyond just going to get a card, right? They have access to real evidence-based education. And, you know, that was, I feel like I call myself an accidental entrepreneur, you know, because I was just really sort of sucked into it by this need. I'll never forget this 80-year-old patient of mine who wanted to use cannabis to treat her nausea. And we knew that she was going to have a regimen that likely would cause severe vomiting, even with our great medications today. And her physician told her no, that she could not use medical cannabis. And this was in 2014 in California. And she said, oh, that's okay. I'll just go to the streets and get it. And she was serious, you know? And I just thought, oh my gosh, there's such an opportunity here to educate and make sure that we're reducing harm for our patients. I couldn't stand the thought of her going out
Yeah,
there.
that's a really interesting point, and that gets brought up a lot with my personal life too, just being from New Jersey, where, you know, some of my friends and family are like, oh, like, you know, recreation and medical legalization doesn't impact me because I just still buy from the same, you know, drug dealer. And it's like, yeah, well, like, do you actually even know what's in that product that you're consuming, or the ingredients in the edibles, or in the vape carts, or in the flower itself? So there, yeah,
Yeah.
it's interesting being, like, you know, so submerged in the industry in Colorado and all these other illegal states, and knowing, you know, humans like yourselves, and then there's still that disconnect,
Mhm.
which makes what y'all do so important.
Yeah.
um Interesting. And when did you cross paths with Katherine and Leaf411?
Oh, it was a beautiful sunny day in San Diego. We met at another cannabis nursing conference, and we just, I think it was mutually, we just fell in love with what each other was doing and stayed in contact. And then, you know, had the opportunity to come on board in a more official capacity in early 2021. So
Yeah, I
Awesome.
stalked her. She's not telling you that I did stalk her. You know, when I became a cannabis nurse, I looked at the leaders, and Eloise was a leader in cannabis nursing. And so, you know, that's the good thing. That's the wonderful thing about nursing. I think in general, we're all tight knit, and we like
Mhm.
following who's leading. And Eloise
Yeah.
was
Totally.
one of those leaders that I was stalking and like, please, I want to meet you. You know.
It's
Yeah,
awesome.
we really work well together. That's what nurses do. They come together for the greater good. You know, we're always problem solving and using that collective voice to help patients.
I bet. I have a random question that just came up before we circle back to what's going on with Leaf 411 now. Since, you know, I'm assuming the COVID, the pandemic impacted Leaf 411, and both personally and in a number of different ways. Did you see a different trend in the types of phone calls, or like an increase in calls during the pandemic, or was there anything interesting that you could share?
Yeah. Yeah, I think it was interesting. So we knew we had to pivot right away and include some COVID education. You know, everybody was, you know, there was an alarm that went off, right? So we said,
Yeah.
okay, we're nurses, how can we help? So right away we focused it on our industry, and we developed kind of COVID guidelines, you know, because here you have dispensaries with staff that know nothing about medicine being told how to be safe with gloves, with masks, and even something as simple as, you know, even going into a dispensary and knowing that they're using the same glove to touch everything. You know, this was way back in the beginning when they were like, clean everything, right? And
Yeah.
then we're saying, wait, That's not how you use gloves. You know, you have one interaction with someone, then you take them off, you wash your hands, you put on a new set. So even something as basic as that is, we needed to tell our industry. So we sent out
Wow.
an email to all of our members saying, you know, we're here for you. We're nurses. You know, first and foremost, we're nurses, and we've been, you know, in nursing for a long time. So we can go over basic, you know, hand washing skills. We can go glove skills, mask. We can teach. We can educate. So that's how we incorporated. As far as our calls, you know, we saw there was an evolution of the call. So at first it was fear. You know, one of the first ones we had was a woman who bought a container of, I believe it was Wana gummies, and she had it prior to the announcement of the pandemic and was afraid to touch them because she said, how do I know? I don't know if this has COVID on it, but I bought them like 2 months ago. We're like, you're fine, but if you want to be extra, you know, okay, you just wash the outside of the container, wash your hands. That's what a lot we had to keep telling people. They were afraid to touch anything that they had even purchased prior. So then we saw that like evolution happen where it went from that to, oh wait, I'm hearing that you can't take ibuprofen with COVID, you know, because of the inflammatory process. And I know CBD can be kind of considered an anti-inflammatory. How do we navigate that? You know, so we jumped on it right away. You know, we have a robust advisory board, so we got Dr. David Gordon to write a statement on what he was seeing as far as what you could do with COVID. And then Eloise, as soon as she came on, we were always relying on Eloise to help guide us with our calls for that. We have a Leaf library, so we were able to put what Eloise and Dr. Dave would say on our Leaf library in a section called COVID and Cannabis. So that way we could, the nurses on a call could guide them, and then they could actually have that at hand, you know. So
Wow.
how do I use, can I use? And some of them too, I remember distinctly a call from somebody, a young man who said like, I don't want to hurt my lungs. I know COVID attacks your lungs. I want to use gummies now. Actually, one of those was a crisis call. He thought because he had such a high tolerance in inhalation that he could eat an entire chocolate bar, which he did. He ate an entire chocolate bar and then he chatted with me actually, and he was very coherent. You know, and those were, even though we're not a crisis line or we didn't set out to be a crisis line, we're nurses, so we're gonna take that crisis.
I personally would have called in crisis if I ate an entire chocolate bar.
Yeah, he was texting or chatting and he's like, uh-oh, I think I made a mistake. I ate the whole bar. And, you know, as nurses, what we do is we triage. So the first thing, and it was like on a Sunday, we were locked down. I know I was painting my bedroom with my husband and my daughter. You had to do something, right? What are you going to do all day stuck in a house? And so I was chatting with him and I, you know, do what our nurses do. Okay, who's home with you? Are you in a safe environment? Are those people impaired or are they, you know, sober? Tell me who's there. Tell me, you know. So in all of that, you know, I was able to reassure him, no lethal dose, all of that, you know, tell me what you're feeling. He was feeling fine. He was just a little nervous. Lay in bed, keep some water there because you're going to get thirsty. You don't want to stumble out of bed. So all those things, and that's the evolution of how the calls went, you know, kind of just more in a panic from touching things to, I want to, you know, keep my lungs clear, trying new routes of administration.
Interesting. It's crazy how just how everyone's impacted in different ways. That actually wasn't what I was expecting you to say. So that's awesome. So another great opportunity that we've had to collaborate together on during this whole, you know, interesting, you know, past 2 years or whatever we're into this now, is the Opioid Awareness Guide. I know, you know, Eloise mentioned that, you know, she has a history with opioids impacting her life in a certain way. I personally do. Other people on my team who worked with this guide. Could you, from your own words, tell us a little bit more about the guide and why you're so excited that we just launched it a few weeks ago?
Yeah, I mean, I think, you know, we've seen some of the statistics come out from COVID about the increase in overdose deaths, again, related to opioids, right? So one of the things that I noticed in my personal practice during COVID was More of my long-term patients were coming in for like a tune-up. They were booking another 15-minute appointment to say, okay, my anxiety's out of control again, or my sleep's out of control again, or my pain's out of control because I'm not moving. I'm stuck inside my house, and I've got my achy joints and all of that. And so, really wanting to bring awareness to using cannabis as an option for pain management, particularly chronic pain, I think is really important, because we have such great evidence to support that cannabinoids are effective for the treatment of chronic pain in adults, yet it's still considered a last resort. We're still seeing some practices that they test you for THC and then they won't allow you to continue the use of your opioids. And so patients really are being put in this position where they're not given choices. They're not educated, they're not informed. So we wanted to bring this guide forward so patients could have a quick reference, something that would help them to say, look, we know that cannabinoids can be helpful. I want to get started on this, to start that conversation with their healthcare professional as well, right? Really give them something that's easy to refer to.
Yep. Yeah, exactly. And that was our goal with this guide series, was, have very important information that's condensed and shareable, so people can easily share it with their family, friends, and anyone can kind of digest it and understand where we're all coming from through our experience and our education and our research. So yeah, it's been an honor working with you on that. I know that can be found on your website, as well as the chat and information to the hotline. And another area that I know has started gaining more traction since the pandemic has started is the Leaf Learning series. I believe that's on your YouTube channel, from what I understand.
Yes.
Cool. Yeah, could you just tell us a little bit more about that and why you're
Sure.
excited about the Leaf Learning series?
Yeah, so the Leaf Learning Series is part of our outreach program. So our hotline program is our first program, and as nonprofits, what your purpose is to develop, you see problems and you develop solutions, and those solutions are your programs. So our first one was our hotline, and then we launched our outreach program, which was in March of last year, was 2 years ago, I think. Yeah. And that was, we had just come out and we were boots on the ground, going to do in-person Leaf Learning series where we'd have a little audience and do kind of some education. Then the pandemic hit, we had to pivot, so we went all virtual. So that's where it started. Now we had to do something virtual. And it ended up being a really great tool. So what we do is we tackle certain topics. Our first one was kind of a Cannabis 101. And then we went to one for veterans in cannabis use, because, on the hotline, we do get a lot of veterans calling, and then they would say, well, I think I'm going to lose my benefits. I can't tell my doctor, things like that. So, we tackle a topic. And that's our Leaf Learning series. So, and we have one, the last one we had was our fourth one, was cannabis for pain management. So that was just ideal, because we take non-identifying data on our hotline with all of our callers. And the number one topic up until this last quarter, so for a year, it'd been pain is number one. And I think that's what what resonated the most with me when I started the hotline. It was just me as the only one, like, hey, the only person on the hotline. And I just was so hurt by knowing that our whole country's in pain, physical pain and emotional pain. Everybody that was calling had some type of pain, either acute, chronic, or emotional pain. It's like, wow, everybody's in pain. So so we knew that that's always lead at the number one topic around the country. So, that's where we grab a topic and we focus on it. And that's why we knew pain management for our Leaf Learning series was important.
That's amazing. Man, you both are so awesome. It's so cool to hear your story and everything you have going on. And I'll be sure to plug in links to the site, the Leaf Learning series, the Opioid Awareness Guide, and everything else that you have going on, so folks can learn more, contact you, and also donate to help the cause, because this is so important. Is there anything you want to leave our listeners with before we check off here? Or how are you feeling about the podcast? I hope it was a good time.
Yeah, thank you, John. I'm so grateful for your support and helping us with the
Of
outreach, because
course,
I think Katherine and I both feel, that we'd love to see the industry, come together, and mature a little bit and start recognizing the opportunities that are here by bridging that gap between the healthcare consumer and the healthcare professional and the dispensary and the cannabis industry and dispensary staff. So, we'd just love to
100%.
see us all coming together for the greater good.
Oh, I'm here for it, and I will continue to be. And our listeners can expect more announcements from all of us in the coming months for sure. So, Katherine, Eloise, thank you so much for your time. I really
Thank
appreciate it.
you.
You have a great rest of the day.
Yeah,
Thank you. Thanks, John.
awesome. Thank you.